Hello, welcome to our show. It's inspiration from COVID-19. Today, Fuey Yin, how are you?
Hello, Joseph.
Hello,
Doing good, thank you.
So, you speak some Chinese, or can you say hello in Chinese to our audience?
Well, not that much. Maybe I could just say ni hao.
Okay, that's good. Yeah. All right. So, can you tell us more about you? Are you born in Costa Rica, or when you start your life in Costa Rica?
Yeah, I was born in Costa Rica as well as my dad. So my grandparents are immigrants from China. They come from Guangzhou, and my mom is from Costa Rica, and myself and my brother were born in here.
Okay. So, what's your profession now? What are you doing now in Costa Rica?
I'm an architect, and I also teach art history at a university.
Mm-hmm.
And right now, I restart my law studies because my parents, both of them, are attorneys here in Costa Rica. So I decided to follow their steps and start again studying law.
Studying law, so you'll be a lawyer one day, or judge?
One day.
One day.
In the meanwhile, I'm working as an architect and as an art history professor.
Okay, good. So, the world is affected by the COVID-19. So how's the situation in Costa Rica?
Well, we are not doing that bad, I have to say. I think our government took some really good things, prepares really good to deal with the disease. Even before we have the first case in Costa Rica, they were preparing the medical staff and how to deal with some controls. They were buying supplies all over because every single country right now is dealing with the situation.
Mm-hmm.
So masks and ventilators are not easy to find, as well as the test. So even though we don't have cases at that time, the government were doing some looking for this kind of things around the world. And the first person positive with the disease came into Costa Rica from the States. It was actually an American citizen. It was on March the 6th.
Okay.
So it has been about a month and something from the first case we have. And right now we have about, I heard the news today, 502 people with the disease being positive.
Okay.
And 29 people recovered from it. And really sad that 3 people died because of the disease.
I see.
So we are not doing as bad as other parts in Latin America, but I think that right now we're on holiday. It's the Holy Week, and most of the Costa Rican people is still Catholic, and it's a holiday starting tomorrow. Those schools, universities, and a lot of companies are closed since last Friday. So a lot of people are moving from the capital city and from the urban area to the mountains, and we are really concerned of what can come after it.
Okay. So do you have, July the 25th is about 2 months before. So now we have over in our countries, I think, over 10,000 cases. So, but somebody asked, they say that the flu normally in cool weather, but in Costa Rica it's very hot, right? So weather or?
Yeah, right now it's really hot. Last weekend we were, well, I don't live near the beach. I live about 2 hours from the beach.
Okay.
And usually we have a temperature around 23, 24 degrees, Celsius degrees, of course. And right now, last weekend, we had over the 31 degrees.
Yeah.
So right now it's a really hot weather. But the virus is getting adapted to it. We also have cases in Guanacaste. Guanacaste is one of the our provinces, where the most beautiful beaches are. And they usually have a temperature over 33, 34 degrees, and there are some people there. So the virus is not really about hot or cold weather. Even mine.
So, and right now in Canada, it's basically we call the city lockdown. City lockdown means that only the essential service people can go to work, can go out, and all restaurants, shops are closed because of the lockdown. So that people are advised to stay home, and unless you walk with your dog or you go out for exercise, otherwise you have to stay home. Do you have similar things in Costa Rica?
Well, the government has been like increasing the measurements they're taking. They actually, beginning, they just ask, stay home, try not to agglomerate in public spaces, but it didn't work. So afterwards, they start. I think that the first things they shut down was the soccer. That here in Costa Rica is a really big deal. Okay. Concerts and soccer. And after that, since March, I think it was our first positive case came in March 6th, and I think it was March 13th, the day that the government closed schools and universities. So, for example, me being a professor in a university, I'm trying to deal with technology. I have classes through the internet with my students, so they keep advancing. But all primary and high schools are right now shut down. Okay. They have like this restriction in which arrive after 10 p.m. only people going to their works. Right now, from Friday, April the 6th, till April 13th, everything that's not essential, and I mean everything but supermarket, gas stations, pharmacies, and hospitals are going to be closed. Okay. The restaurants, they only have permission to do delivery, no people dining in. No, just deliveries, and you can only take your car on one day of the week. For example, my plate, it's I think it's gonna be able to circulate on Friday, Holy Friday, but that's the only day I can go out.
I see. So 1 day per week per person, all right? Or so how do you know?
Only for this week because of the holiday.
Holiday. Okay. After that, then go back to normal. So we still can go out with cars.
Not exactly. There's a restriction in which you cannot drive from 10 p.m. to 5 a.m.
Oh, okay.
No matter what your plate is, you cannot go. You're gonna be
stay home.
Fine. And we have our license is with a point system in which you're gonna lose points, about 6 points out of 10 of your license. Yeah. So when you want to renovate it, you have to take a course, and you have to pay a lot of money for it. So it's kind of a way to ask people once again, please stay home.
Okay. Do you see a lot of like policemen guarding on the street, or guys?
I haven't been out of my house in about 2 weeks.
Okay.
So
you're pretty obedient.
It's not like
you follow.
Yeah, I'm in a good around my house. You can see a lot of police. But I've been watching the news, and for example, in the downtown, you're gonna see the streets mostly empty. Okay. But because people went last weekend, a lot of people try to go to the beaches, and the beaches right now are closed. Oh. The police put like this yellow tape around it. Okay. And if you are, and it's illegal to be right now in the beach. Okay. We are dealing with some tourists that stay in Costa Rica because they do not understand all the regulations and why you cannot go in there. I'm on my vacation. I'm not from Costa Rica. I don't care what's going on in here. But most of the people, it's trying to take care of each other. So I was hearing today in the news that, for example, people in the coast area, they keep calling the police. You know what? There's 2 or 3 people coming into the beach. The police goes and do their job.
Yeah.
So the same community, it's trying to take care of themselves.
I see.
Because we're a small country, and we don't have actually the resources to deal with a situation like the one people is having right now in New York or Italy or Spain. We're really small,
Okay.
and we have 500 cities. So we have to take care of our resources.
Yeah, okay. Yes, 5 million and then 5 people. Okay, 500. Yeah, that's high ratio. Yeah, that's correct. What about social distancing? So here in Canada, we 2 people working together. They have to be 2 meters apart. You can walk side by side.
Yeah, actually, when you go, I went 2 weeks ago, and I went out because I had to go to the supermarket. Yeah. That's it. Mm-hmm. And it was really impressive for me that they put marks on when you go to the cashier. Yeah. And there are marks on the floor where you can stand in the line. Yeah. And they have just a few amount of people inside the store, mm-hmm. and the rest of them have to wait out until someone comes out. Yeah. And they also have marks in the street trying to keep people apart. Mm-hmm. But the Costa Rican people, we're really warm, and we're really used to hug ourselves and kiss ourselves. Yeah. And it's been weird, and it's been hard to a lot of people to understand that mm-hmm. you have to keep apart. Yeah. Right now, for example, it's a really weird situation for the most of us. Mm-hmm. I wrote one of these days on my Facebook, Costa Rica is a country with no army since 1949. Mm-hmm. So I don't know what's to see an army, or I have never think before of Costa Rica going into a war, and I've never, kind of realized what that means, because you see it on the movies, and I hear my friends talking about that, but it's not something you get to deal with because we have no army. We're so small, nobody cares about that. They were talking on the news like, we have our soldiers in the hospital, and those are the front line, and we're going to stop the disease, and Costa Rica is getting ready to go into a war. And it was like the moment that I realized it's serious. And mm-hmm. yes, we're going into a war. Right now we're preparing to deal in our territory. Yeah. So for me, it's been shocking, and it's really been mm-hmm. really, really, really awkward because I've never thought of that before. Yeah.
So similar situation to Canada, because Canada is so big. We got about 37 million people, but it's a huge country. So normally we don't see. Yeah. Normally we don't see the policeman on the street except in downtown area. All right. So yes. And no soldiers, because the soldiers are in the camp, in the town. So, but recently our Prime Minister said that we may need the soldiers to help with delivery goods, or in case some place they need help, so that the soldiers can be there to help. So that we start to see the military vehicles on the street, and they warn us first that.
Oh no. I'm sorry. When I said about the soldiers, our minister was talking about our doctors and nurses and the people that's working at the hospital. Yeah. That's the force we have to confront the virus right now. Yeah, that's why they're calling them our soldiers.
Our soldiers. So
it's been really weird for us, because we've never realized before that something like that could happen in Costa Rica.
I see. So at war, that means the war against the virus. That's why it's the soldiers.
Yes. Yeah. I'm sorry if I didn't explain myself.
That's okay. Okay. So right now we do. That's why we don't need the soldiers now. But the soldiers are in certain city, so in case we need them, they can come to help us in case for anything else, like build the hospital. We don't have enough hospitals in Canada. If there's so many patients. That's why they try to build a temporary hospital, so like what China did. So that's the case.
Yeah. I don't think any country in the world has enough hospitals for what's going on. I don't think any single country in the world could be I I was really amazed. I'm an architect, so I know how hard it is to build something or to rebuild something.
Okay.
But right now, because of the emergency, I had to readjust. We had this clinic that was only for rehab, like when people were in accidents or they have strokes and they need rehab to go back to walk and to gain their mobility again. So we had this hospital that was only treating with those kinds of patients. People in other places, or we can to do the exercises in their homes, and we're gonna take this hospital and we're gonna readapt it, or we're gonna adapt it to receive only COVID-19 positive patients, and they did it in only 11 days.
I see.
And it was amazing. I mean, it took 11 days, only 2 weeks to have a complete
hospital.
Equipated hospital. But it only has 88 beds.
I see.
And so what the authorities of the government is asking us is stay home, because we know people is going to be sick, and we don't want them to be sick all at the same time. Because in that case, we won't have enough beds for everyone. We won't have enough, and we don't have enough medicines and ventilators for everyone. So it's to gain time. That's all we can do.
In Toronto, in our city, we don't have enough beds in hospital. So when the doctors classify that some are severe, to stay home for self-quarantine, unless you go serious. Otherwise, you all stay home. And that's no treatment, because there's no vaccine right now. So that's bad.
If we should wear mask or not.
Okay.
And everyone around you is wearing a mask. Yeah. But it's not something you see here in America.
Okay.
And you never see it before in Costa Rica. So it's kind of weird to see people outside wearing a mask, even though the authorities are asking us no. Because first of all, we don't have enough for the doctors, who are the ones that are going to need it. And second of all, because we don't know how to wear the mask correctly, so you see people with their nose showing up, the mask, or they don't wear it the right way. And the third thing is because we're people that hug and kiss, and so you see people in the street. And the day I went to the supermarket, it was really, really, I don't know to say if saying funny is the right way. They felt they can do so. So I think that's why the authorities are asking us not to do so. It's better to feel that you cannot get close to the other person than feeling that you can come and hug them because you're wearing a mask. Because it does not work that way.
Yeah.
Maybe in Asia, where people it's a little bit more used to social distance, it's okay, because people understand that you don't have to hug and you don't hug people in the street. But here in Latin America, it's kind of hard to be making people to understand that social distance is so important.
Yeah, that's true. Same thing in Canada. If it's Chinese student, if they wear masks in school, then the teacher will say, if you are sick, and then you go home. You cannot stay in school. So that looks like a kind of like discrimination. But for Chinese parents, they heard the news. 2 months ago is very severe. It's a case in Wuhan, Hubei, right? So that means that we sense the importance of the disease, and then we feel danger. Then that's why we try to wear masks. But here, as I say, American culture is different. They say that you are sick, then you stay home. Okay, you then don't wear masks in public place. But now it changed tone, because it's more people getting sick, because we got record numbers of patients every day. So that then the medical officer say that now you can wear masks, but you have to wear masks correctly, and then you may save yourself not spreading the virus. So that's the kind of the same argument in here. But when you look at China or Asia, they this looks like that the mask is really protecting, spreading the virus. Here, you don't have mask, you don't have protection. That is quite dangerous. And on the other hand, you're right.
And,
if you want to wear a mask,
and
you can buy it. It's shortage of the mask.
Yeah.
Can
and I don't know about Canada, but in here, for example, you are not able to buy the same kind of mask that doctors are using.
Mm-hmm.
So you see people wearing whatever they can find as a mask.
Okay.
So the doctors are also saying, you know what, that offers you no protection. The only mask that works is the one that you get from hospitals.
Okay.
Those things you're not wearing, those just doesn't work because the virus is not in the air. Wearing those kind of masks, like for example the ones you use when you're painting, or the ones you use when you're working with wood, or the ones the dentist uses, they don't work, and those are the ones you can get from the supermarket.
Okay.
Or there are a lot of people selling them on the streets.
Yeah.
So it offers you like a fake security, and it could be more dangerous if people does not understand that if you're not wearing a mask correctly, it doesn't work.
Mm-hmm. Okay. But if you say you have something, covering your mouth, you feel more safe, rather than just like you don't have anything. So that's probably the cultural difference. Yeah. So,
yeah, sure. But right now, the only thing that I think, and I talk to my brother every day, like, you know what we can do, and he said, just stay home. Just stay home as long as you can.
Okay.
That's it. Don't go out if you don't have to. I'm really lucky because I can work from home, and I'm giving my classes through the internet, and I'm taking classes through the internet.
Okay.
But I know there's a lot of people that cannot just say, well, I'm going to stay home for 3, 4, 5 weeks, as long as it takes. And I know I'm really lucky and really blessed because of that. But right now, it's the only thing we can do.
Yeah.
And the economy is going to be really harmed because of this. We are a country that our main income comes from the tourism.
Okay.
And right now, we are completely locked down to tourism.
So no international flight. So no air flight. Oh, okay.
No.
Yeah.
Nobody's coming in till April 30 by the moment. For example, is a resident here in Costa Rica that it's not a Costa Rican, that like you are from other country and you just have your residency here. You go out, you are not gonna be allowed to come in again. You're gonna lose your residence in case you go out, because we're trying to protect the people inside. You here, but you're not gonna be able to come in again.
So you can come back. So.
No.
Yeah, that's the thing. Yeah, same thing. Canada is locked down to no international flight. So we have some Canadians in Peru, in Europe. Our government has to send a charter flight to repatriate them back to Canada. So and people have to pay for the flight by themselves. So at the beginning, government paid for it, but now you have to pay for your own air flight. So it's more expensive. Yeah.
Yeah.
So, that's bad. Yeah. But anyway, I think our title for this program is called "Inspiration from COVID-19." Do you have any inspiration from this crisis or this virus? Can share with us?
Oh yes. You know what? In the middle of everything that's going on, it's been really helpful. We have the government universities. They, as soon as the first positive case appeared, they start trying to find a way to build masks for the doctors, and they did it. And right now, they are producing security equipment. I sent you some pictures of my brother and of his co-workers, and they're wearing protection equipment. With those are not produced by the university, kind that the universities are producing, because we know we are not going to have enough. We also have our universities working with the scientific part and the engineering parts of the university working, trying to find a cure. So they are actually working on this new plasma idea that, you know, with the people that recover from COVID, they take their we have seen a lot of helping people. For example, my internet company duplicate my internet wideband for free, so I get to work from home during these days. So, you know, solidarity has come out in a big wave that overwhelms us. I've seen a lot of people that is telling other one, you know what, I know you were fired from your job, because a lot of jobs are being lost in these days.
Yep.
So I know you were fired, so you know what, you need something, just let me know. And people, it's collaborating a lot with each other. And that's something I think we should feel proud. We have one of the lowest rates of mortality in the whole world. And we're a really tiny country, and we are doing it. And I know if people do what we should, we are going to get out of these with as less casualties as we can. And I think that's something we have to be really proud. I think the authorities are doing a really good work. The people in the parliament from different parties, political parties, they came to agreements really quickly, approving laws that are going to help the government to take actions, you know, like this car restriction they came out with the money to reveal the hospital, and they approve it really fast. And so people are working together to get out of these as soon as we can. And I think that's something we should really be proud of. And I know that after everything passes, because it will pass for sure, someday we're going to see it as a bad memory, but all of us are going to be different persons. We're going to learn a lot of things out of it. We have to learn to really estimate the little things. You know, for example, my birthday is tomorrow, and I know I'm not going to be able to see my brother for the first time in my life because he's working at the hospital.
I see.
So it's going to really be really significant the next time we get to be together, because we haven't seen him in about, 3 weeks from now.
Okay.
And we don't know when we're going to be able to see him again, because being working in a hospital, it's not safe for him to come to my house or my parents' house, so we're got to be apart for these days.
Okay.
And after everything passes, we're just gonna be better people, I guess, and I hope.
Yeah. I never been to Costa Rica. Can you tell us more about what's Costa Rica? I'm looking at a map. It say that it's famous for beaches, volcanoes, biodiversity. So, are you living in San Jose? Or?
Oh, and there's another thing I forgot to say. I'm really proud about the help that the Chinese government is giving us right now, and I really have to say it. People from Chinese restaurants, food for the doctors and nurses at hospitals. The Chinese community here in Costa Rica, they came together and make donations of health equipment and ventilators as well. So that's something to be really proud of. And about Costa Rica, I could talk a lot about Costa Rica. It's really famous because of our beaches. We have amazing beaches in here. We have every single kind of beach you can wish for, with a lot of waves for surfing, with no waves for kids, with reefs if you like snorkeling, white sand, black sand, and they're really amazing. We have about the 5% of the world biodiversity here in the country, and it only measures about 51,000 square kilometers, and we hold 5% of the biodiversity of the whole world of our planet. And we don't have an army. All the money that could be destinated to an army is actually destinated to education. So we have really educated people in here. it's a really warm place. We live mostly out of tourism, as I told you before. So we had a lot of places for tourists to go. The infrastructure in the coast are mostly orientated to receive people. It's a really, easygoing. Our motto is Pura Vida. That's mean like enjoy the life.
Okay.
And take it easy, don't rush. So everything in here is Pura Vida.
So which month is the best weather to go to Costa Rica?
I think
lots rain or no rains?
From December to March.
Okay. December to
At that time, you have no rain. Yeah, and the weather is warm. But if you go to the coast, like to Guanacaste, Punta Arenas, or Limon provinces that has our beaches. Well, Limon is in the Caribbean coast, a little bit more rainy.
Okay.
But Punta Arenas and Guanacaste, you can visit them most of the year. We have a temperature around 20 to 23 degrees. It's about 8 degrees in a whole year.
Yeah. So you live in San Jose, or where do you live?
I live in a place called Heredia, from the main international airport. But it's about 15 minutes from San Jose.
I see. Okay.
Yeah.
Right.
Yeah.
So
it's a small country. I mean, you can go from one point to the north point to the south point of the country in just one day.
Okay.
So it's a really small country.
Yeah, you say 5 million people, so not much. I came from Hong Kong. Hong Kong has 7 million.
So, I had a friend that visited me about a couple of years ago, and we went to. He was going to be here just 3 days, and he wanted to go to the downtown, to the historic district, to the beach, and to the volcano. And everyone was like, "You're crazy! I mean, you want to go to?" We went to the volcano, we went to the beach, we went to the historic district, and we went to the downtown of the capital city in just 3 days.
I see. Go on, I see.
He did it.
Just to let you know that we usually have the last snow around Easter, so we may have a snow 2 days later. So yeah, we're enjoying the warm weather. We're expecting a snow. So anyway,
no.
Yeah.
I'm right now.
All right.
It's for you to take an idea.
To try to get an idea, and then we hope that the virus will go away soon, and then probably we can talk again after the virus. And you take care, your family take care, wish everybody, especially your brother, safe and healthy. All right. In touch. All right. And thank you for.
Sure.
Okay. Take care.
As soon as it can.
Sure. No problem. Whenever you got a law degree, and then let me know. All right. Okay. Take care. Bye.
Sure. Thank you.
Bye.
Bye.